Hello, how are you doing? Okay, so you're here for your cranial nerve exam? That's right. Great. So my name is Dr. Eclipse. And tonight I'm gonna be a doctor, and I will do your cranial nerve exam. Tonight we're gonna go for a really detailed one, if you don't mind, of course. Yeah. So we have a lot of time ahead to inspect you really thoroughly. Don't worry about that. And I guess that first we'll start with confirming your personal data. Okay, good. So your first name would be good. Got it. Yes. Right. Your last name. Okay. Your date of birth. Okay, perfect. Thank you. Now, okay. I believe that we have all the rest. Okay, wonderful. Okay, good. So, please tell me, how have you been feeling lately? Have you had any complaints regarding your health, your senses, or your body functions? Anything related to the way you feel? Okay. And how often would it happen? Like approximately on a scale from 1 to 10? Yeah. I see. Okay. I will take some notes in the process, okay? If you don't mind. Oh, that's fine. It's okay. You can trust me. Good. Okay, yes. And you were saying that... right. Have you ever had actual problems with that? Have you seen the doctor about it? Okay. Anything else you'd like to tell me? How do you usually feel when you wake up in the morning? You feel energized? Okay. I see. Okay, how many hours of sleep do you usually have? Okay, got it. And then do you have really like fixed schedule? Do you go to bed approximately at the same time every day? Okay. Well, I think that you should work on that. Yeah, that'd be great. To have like a really fixed schedule. That might be good for your body rhythms, biorhythms, and then in this case, you might start feeling really better soon. I will write it in all these general recommendations that we'll give you after your cranial nerve exam. Okay. Well, anything else you'd like to tell me? You know, I might ask some questions in the process, yeah, when we start discussing all these separate senses and all these cranial nerves, yeah. So, I guess that we'll start with the first one, which is olfactory nerve. And basically this is the nerve that transmits the signals, the sensory information about the odors surrounding you, and it transmits all this information to your central nervous system. Yeah, and then later your brain identifies them as some certain smells. Well, there is such a thing as anosmia. So when you can't feel any smells, or they can be also sometimes different from what they actually are, so they might seem different to you, or you can feel only certain ones. So it can be kind of like partial or full. And in this case, there can be multiple reasons for that. It can be even genetics, but it can also be some kind of head injury. It can also be COVID-19, unfortunately. Yeah, for many people it caused temporary anosmia. And like basically it can even be this mucus blockage in your nasal cavity, in your nose. Yeah, I mean, like, you know, you've probably noticed that when you have some kind of a nasal congestion, you cannot feel the smell as well. You cannot feel the odors as, yeah, the same as you did before. So that can be the reason as well. Have you experienced any kind of nasal congestion lately? Have you had any colds or like anything like that? Are you sure? Okay, great. And actually, anosmia can also be like a signal, a feature of the early stages of Parkinson's disease as well. So, yeah, in case you feel that there's something wrong with your sense of smell, it's better not to toy with that, right? So it can be quite serious. Alright, so I'm not here to you know, scare you, so let's test it right away. So I have different testers, and I have just some Q-tips in here. Okay, give me a moment. Okay, let's get this one. Yep, that's right. I'll put some. It's like a liquid tester. So I'll bring it a bit closer to your face. Please give it a smell. Don't hurry. Take your time. Okay, so what do you think? What did it smell like to you? Are you sure? Okay. Yes. Yeah, that was actually peppermint. Good. Now I will take just another Q-tip, and I will also get another kind of water that you'll have to smell, and you will tell me what it smells like to you again. Okay. Good. Please take a sniff, take a smell. Would you like to try one more time? Sure. Okay. So, any idea of what it could be? Right, that was lemon. Sure. Okay. Well, your sense of smell seems to be just fine. Okay. Good job. Now, the second one is your optic nerve. I guess that we might check them in exact order today. So I promised you to do a really detailed, medically accurate, obviously, cranial nerve exam. So we'll be super accurate and we will go in the same order as like they are given in all these classifications and stuff. So I mean, yeah, sometimes cranial nerve exam can be a little bit more chaotic, even more creative, I would say, and it can be fun as well. But yeah, tonight, like I promised, so optic nerve it is. So you might have already guessed, so this one usually transmits some visual information, right? And so this that comes from your retina to your brain. Exactly. And so basically the very first thing I'm gonna do is inspect your pupils. In the first place, they are supposed to be of the right size, which can vary a little bit depending on the lighting, on the light. Yeah, so with brighter light, they of course shrink in size, yeah, get smaller, and with a darker surrounding, yeah, in the darkness, they are supposed to actually get a bit bigger. Okay, and then another thing that I wanted to mention is that their shape, yeah, so they are supposed to be symmetric in shape and like round. Yeah, if something goes wrong, yeah, there can be some exceptions to that, but naturally they are supposed to be just that way. Okay, so let me have a look at your pupils. Okay, great. Okay, wonderful. No, good. So it's totally fine. Well, and then the next one, let's have a look at your pupil reaction to the light. Okay, so now they're back to their normal size, and this way. Okay, wonderful. And on to the other one. Good job. Okay, now let me have a look at this other eye. The way it is. Good. No, well, I don't see anything abnormal for now. And now the other thing is that the optic nerve is responsible for your vision acuity. And the best way to actually measure your vision acuity is to use a Snellen chart. I guess it's not a surprise for you, probably. Okay, I have one behind me, but let's use this one for today. Okay, so now, right now, I'm like at around 6 meter distance from you, and that should do. I'll just put this chart like this way, right above me. Okay, so please tell me, what is the lowest, the smallest line that you can read? Let's try with number 6. Okay, let's do it. Okay, so that was 6 meter distance. Now I will bring it a little bit closer to you at 3 meter distance. Okay. Now please tell me which is the lowest line that you can see. Could you please read it to me? And now 1 meter distance. So once again, which is the lowest line that you can see? Okay, can you see it well from this point? I'll put it here in the center of your field of vision, if you don't mind. Is it okay now? So which is the lowest one that you can still see and you are able to read? Okay, Okay, would you do that for me? Okay. Great. Okay, wonderful. Now I will ask you to close one of your eyes and read the same line. Yeah, just close it. Keep it that way. Okay. Good. Now please close the other eye. Right. Good. Well, basically, if you make like 2 mistakes in the line, it is still alright, like more or less. If you make more than 2 mistakes in one line, then in this case, the previous one is considered your acuity level. Right. Okay, good. So now let's skip to the next one. Let me take it down this previous results. Yeah, basically there can be multiple reasons for this decreased visual acuity. So it can be again like some genetic factors, it can be some like ocular media opacities, it can be basically some kind of injury as well. It can be optic nerve pathology, so that in case if it doesn't function the way it should, these can be just like age-related degeneration. So there are a lot of factors that could contribute to that, but it's like your vision acuity seems to be just all right, nothing to worry about. Good. Okay, wonderful. So we have already checked your direct pupillary reflex, right? We've seen how your pupils react to the light, to the direct pen light, to torch lights. Yes. Yeah, we've observed this pupillary restriction in like both of your eyes. Okay, good. So now, just a second. Right. Okay. Now I will just switch the light rapidly between the two eyes, two pupils of yours. Just, it's called usually like a swinging light test. So basically, I just do it once again. Okay. Yeah, just try to relax, like there is nothing you can consciously do with it. Good job. Okay. All right. Good. Okay. Now, could you please look at the Snellen chart behind me? Good job. And now look at my thumb. And now once again focus on that Snellen chart behind me. And now look at my thumb again. Okay. Great. No, you're doing just fine. It's alright, I haven't noticed any abnormal pupillary responses, so it's just totally fine. Okay, now your color vision, and for that purpose, we have Ishihara chart and test. So give me a moment. Just take it out, and I will ask to cover one of your eyes right away. So, can you see anything here? So you can see some circles. How many circles can you actually see here? Right. Okay. Now please tell me what numbers you can see inside them. Let's go from the sides. Okay. Good. Okay. What about the next one? Okay. Good. And now what about this one, the bottom line? And to the next. And once again to the next. Okay. Wow, not so bad, I must say. No, good job, actually. You did really, really great. So now I will ask you to cover the other eye. And so let's do another plate of tiara tests. So a bit different ones, okay? Because I don't want you just to use your memory for this one, for this test. So I want you to actually tell me what you see. Okay, so I suppose that this way. Here we go. Okay, so have you covered the other eye? That's right, exactly, good. Now please tell me again, what can you see? Right, in the circles. Okay, good. Okay. Yeah. And what about this? Good job. And finally the very last one. Okay, amazing. Good. Let me take some notes so that I don't miss anything in the process, okay? That would be a pity. Okay. That would actually be a disaster. Okay, just kidding. Yeah, good. Okay. So basically I haven't noticed any color vision deficiencies. So everything is just fine. There can be different reasons for that again. So even like deficits of some vitamins, like A vitamin, some like other macro elements, but yeah, so in this case it's just all right. Okay, so just a second. Okay, good. Okay. I'm just trying to take all the notes right in the process, not to get distracted, later. And it's just like they are most accurate now. Then I might just miss something out. I wouldn't want that to happen. Okay, so thanks for your patience. Many people actually say that they find this writing sounds, typing sounds quite relaxing in the process, so I hope you do. I hope that not annoying for you, not irritating. Okay, good. Right. Good. Okay, now another thing. Let's check your side vision, and also the same which is called like visual neglect or inattention. So let's see how attentive you are and how aware you are of all the objects in your field of vision. I'll wiggle my fingers for you, okay? And you just let me know, like you can concentrate on my face and look at my fingers directly, please, right? So you can look at my nose, yeah, like let's choose some fixed point on my face, right? And then I might wiggle my fingers on maybe both hands, maybe one of my hands, yeah, and you just let me know whenever you see some movement, okay? Good. Mm-hmm. Mm-hmm. Okay, so now I did on both of them. Good, good, wonderful. Now you identified everything correctly. Good. It just happens sometimes, yeah, when it comes to both like attentiveness and also visual fields and everything related to your peripheral vision and stuff. So, okay. Now let's test your field of vision and the blind spot. So I will ask you to close one of your eyes. Okay, so if you close your right eye, for example, I'll close my left eye. Okay, and so now please tell me when the red tip of the hammer appears in your field of vision. It's basically on the same distance from you and me. Okay, good. And what about now? Just tell me when you can see it. Okay. Now let's try with the other eye. I'll cover the opposite. This is like a mirroring effect. Okay. The next one. Okay. Good. Thank you. Right. Yeah, good. Okay, so now let's have a look at your oculomotor and trochlear nerves. Yeah, and also abducens nerve, which are responsible for your eye movements. Everything related to the way you can like move your eyes to different sides and like stuff like that. I will ask you to follow my fingers with your eyes only. Please don't move your head. Okay, scan. Okay, please follow the light for me. Okay. Good. Now let's test your corneal reflex. Please look at my fingers. Yeah, concentrate on some certain object with your both of your eyes. Okay, good job. It's alright. Now your trigeminal nerve. So this is mostly responsible for your face, yeah, and actually the way it like works, and the muscles and everything, how like starting from your facial expressions and finishing with your jaw jerk reflex and stuff like that, yeah. So actually this trigeminal nerve, it's easy to guess from the name. It has three main parts, three main subdivisions, which is like ophthalmic, which is more about this upper part of your body, including your forehead and your upper eyelid and stuff like that. Then the next one would be actually maxillary, and basically this one is more about these parts like your cheeks, your upper lip and stuff. And then mandibular, which is more about your chin, your lower jaw, and everything located in this like lower third of your face of your head. Okay. And basically the main ways to assess their work is to have some sensory assessment, like I might touch your face really slightly or prick it really slightly with other special tool. Yeah, and you will just let me know if you can feel it, where exactly you can feel it, and stuff like that, right? So I do believe that it's not gonna be really that challenging for you, right? I hope so. Okay, so there we go. Just let me know when you can feel the touch on your face, okay? I will get a brush. Close your eyes, please. Yeah, don't look, otherwise it wouldn't make any sense. So, okay, where exactly did you feel it? Okay, what about now? Where exactly was that? And now once again. Okay, good. Oh, great. Now let's check your jaw reflex. So I'll put 2 fingers on your chin. I will also ask you to open your mouth. And I will just use the hammer, but really slightly, so no worries about that. It's not gonna hurt. Okay, so open your mouth, please. Oh, it was alright. Totally fine. So like I told you, so the main thing is that your mouth is supposed to close slightly, so there will be slight closure of your mouth as a response to this action that I did. Good, and it was totally fine. Okay, now so before we have done this corneal light reflex, when you were looking at the object, and I was actually using the light to see how your pupils react. Now let's have the actual corneal reflex test. So you will have to look some direction, for example, let's say this one, and then I'll approach your eyes from the other side, and I'll do a slight movement so that we can check if your eyes actually react to it. They're supposed to just close. Okay, so please look at my fingers. Okay, just relax. Good. All right, something closed. Good. It's also called blink reflex sometimes. Now to this side. No, okay, good job, wonderful, everything works. Okay, now the facial nerve. So it is partly responsible for your sense of taste, yeah, especially these parts of your tongue, which it is connected to, and basically that's what we are gonna test now. Yeah, okay, so, and of course you have like facial movements as well, like all this face expressions and stuff like that. So let's test your sense of taste in the first place, and then we'll skip to your facial movements, face movements. Okay, would you please open your mouth and stick out your tongue a little bit. I will drop a little amount of this substance onto your tongue, and you will just tell me what it tastes like to you. So, do you have any idea of what it could be? Once again, please don't hurry. It's all right. Okay, right? Yeah, that was orange actually. Good job. And now let's try one more. Just okay. So the same thing. Open your mouth. Okay, wonderful. So just give it a try. There is no hurry, though. It's all right. So what do you think it was? Something like coffee, similar to coffee? Okay, good. Now, your facial movements. Could you please raise your eyebrows at me? Good, wonderful. So now, I would like ask you to just scrunch up your eyes, yeah, so we close them really, really tightly, and don't let me open them. Good. Now, blow out your cheeks. Okay, and the same thing, just don't let me deflate them, okay? So, good, wonderful. Okay, now I would ask you to like purse your lips. Can you actually try to whistle? No need to whistle, but yeah, just put your lips in that position. Okay, and of course, see your smile. Can I see it? Yeah, exactly. Okay, wonderful. Good job. Oh, let me take just a few notes. No, you did really well, so it's alright. And now one of my favorite ones, vestibulocochlear nerve. Okay, so basically, in other words, it's responsible for your hearing mostly, and your balance, of course, like vestibular parts of it. Okay, good. So I'm gonna say simply a few words and a few numbers, and I will ask you to repeat them, right? So nothing really challenging, okay? Okay, good. So please, are you listening? Are you paying attention? Okay, good. 24. Okay, good. Now the next one. 31. Okay. 65. Okay, good job. Wonderful. No, that's all right. So now, the next thing. I'm gonna try. Before this, I tried more or less like soft-spoken conversational voice, and now let's try and whisper. So just concentrate, okay? 81. 100. 38. Okay. Wonderful. Okay. Now, the tuning fork. So I'm supposed to place this vibrating tuning fork right behind your ears. It's like okay. It's more about this bone conduction. The bone that is located right behind your ear, right there. You can feel it. That's right. That's the one. So now you cannot hear it anymore. Okay. Good. So now into the next one, the other ear. Okay. Okay. Wonderful. Good. So now that's all right. It's more about this bone conduction, air conduction, and other stuff, but you did it okay. Okay. Good. Now there is another test, Weber's test, when I have to put this thing, the same tuning fork, in the middle of your forehead, somewhere there. Yeah, okay. So, are you ready? pretty much the same, but you will just tell me where exactly you can hear the sound, okay? Right, so okay. So where exactly could you feel the sound and the vibration? Are you sure? Okay. Good. Got it. Now, the vestibular testing. I will actually ask you to just stand in that position, like, yeah, just stand up. And you are supposed to close your eyes and straighten your arms and just march in place in the same spot, just like make a few steps. Okay. So now I'm just supposed to see if you are leaning towards me or something. Yeah, if you can stay at the same position. So you're actually supposed to remain in the same position without like leaning, like balancing to one side or to the other one. Okay, good job. That's just fine. Now, glossopharyngeal nerve. Yeah, and also the one that is like really closely related is vagus nerve as well. Okay, so from the names, yeah, it's easy to understand that it's like mostly related to your tongue, to your pharynx, to the way you like swallow test is one of the part of testing how this nerve functions and stuff. Okay, and just write all the previous results as well. Okay, so could you please cough for me? Oh, you can do it perfectly fine. That's all right. Good, that will do. Now there is a glass of water right next to you. Could you please just take a sip, like swallow it for me? Okay, great. So now I will just inspect the palate and the uvula. I will take a spatula for that. So open your mouth and say ah. So now I'm looking at your palate and uvula. So the uvula is supposed to remain just in the midline, without leaning to the other side. Good. And since we've already had your swallow reflex, we won't do the gag reflex today. Yeah, right now there's no need to do that. But yeah, sometimes they also do it in this cranial nerve exam as a part of it. Yeah, so but it's a bit unpleasant, so I'm not gonna torture you that way today. Okay, now the accessory nerve. Would you please shrug your shoulders, raise your shoulders for me? I will try to put them down and you have to resist me. Okay, wonderful. Now please just try to do the same thing. Try to shrug your shoulders again, but I will just try to put them down right away and you try to resist me and raise them. Good. Okay, wonderful. Great. So now the next thing, the other thing, we will also check your hypoglossal nerve. It's more about your tongue movements. Yeah. So I will just put my fingers onto your cheek, and you have to put your tongue against my fingers on your cheek. Okay. So can you do it? Wonderful. And now same the other side. Wonderful. Okay, amazing. Good. So everything seems to be just fine. And now finally, I just want to take a pulse if you don't mind. it's not really necessary. It's not a part of the cranial nerve exam as such, but so is it all right? Yeah. I'll just look at the time. Yep. Okay. Okay. No, it's totally fine. How are you feeling? Okay. Do you have any questions about any of these nerves that we were testing? Maybe something totally different, something related to your house, something related to the way you feel? Okay. Is there anything you think I should know about? Alright. Okay. Sure, you could take this water. Oh, of course, yeah. Is there anything else I can get you? No, it's fine. Okay. I feel good. Great. Well, we will actually send all the results, all the conclusions to you later. But in general, you did really, really good. So there is nothing to worry about. Yeah, like I said, I've been writing and taking all of your results here, taken down. Yeah. Sure. Yeah, of course, we were extremely thorough with this test this time, so there's nothing you should worry about. We haven't missed anything, we haven't skipped anything. Exactly. Okay, great. So I was really glad to see you today. Yeah. Have a good one. I'll see you soon. Sure. See ya. Bye.